Spearing acupuncture. Acupuncture originated during the Warring States periods in China. At that time, China was in a period where new countries were constantly being created and disappearing. Consequently, battles were incessant, and there were many soldiers injured in combat. Most of the injured soldiers were wounded by spears and arrows. Because those wounded by swords were unlikely to survive close combat and return alive. In this chaotic situation, one medical officer who treated wounded soldiers for over 20 years was compiling records of their treatments. He noticed that patients with injuries on both sides of the spine experienced less pain and were discharged earlier than those with injuries on only one side. Consequently, he began performing clinical procedures that involved piercing the symmetrical side of the wound with a sharp spear on severely injured patients who complained of excruciating pain. Surprisingly, he found that the patient's pain was alleviated. This was the first instance of acupuncture, which became the origin of all existing acupuncture practices. However, acupuncture using spears had the following issues. Many patients experienced extreme fear or sometimes fainted, so the spears were gradually made smaller for the procedure, eventually became needles. Over the past 2,000 years, the origin of acupuncture was forgotten, and over 100 types of acupuncture were developed in China, Japan, and Korea. However, they were unable to scientifically explain the principles of acupuncture. From spear to needle, as previously mentioned, the first form of acupuncture needle had the same shape as a spear. However, the method of piercing with a spear caused mental stress for both the practitioner and the patient. Therefore, it naturally evolved into a treatment technique that maintained its effectiveness while reducing the size of the spear. According to the conventional acupuncture method, the needle is rotated to the right when inserting it into the skin and to the left when removing it. In the past, needles were made by grinding with a whetstone, which made it difficult to maintain a straight line between the needle's central axis and tip. During the procedure, the needle insertion and removal caused the skin's interior to be damaged, similar to how it would be if drilled by a power drill. Pain cells in our body are distributed around the skin surface, so we only feel pain on the epidermis. As a result, even though the pain is minimized compared to the depth of the wound, the internal skin wound becomes the same size as the wound made by a spear. This is why the acupuncture needle has become smaller, like the ones we use today. So, how does the body react to intentionally created puncture wounds, and what is its principle to reduce pain from injuries? Pain is a product of the survival of humans, who are mammals, surviving for hundreds of thousands of years in harsh environments through natural selection. When small wounds occurring during daily life grow larger, they threaten survival, so pain signals were necessary to protect the wounds. However, if pain persists excessively, it can make daily life uncomfortable, so people had to find ways to reduce or change the direction of pain signals. The principle involves creating intentional puncture wounds on the symmetrical area of the wound to disperse pain signals. Both sides send the same pain signals, but since there is no actual pain from the puncture wounds made by the needle, the pain signals from the injured area decrease. Acupuncture in the past was mainly used to relieve pain that occurred in joint areas. Yin-yang and the five elements theory. Prior to the explanation of the yin-yang and five elements theory, let's review the treatment method developed by Indian neuroscientist Dr. Ramachandran, which addresses phantom pain experienced by about 65% of amputee patients. This method involves showing the opposite arm in a mirror to a patient who has lost an arm, making it appear as if the lost arm is still there, and moving the phantom pain area to make the pain disappear. The use of mirrors in treating phantom pain remains unexplained in modern medicine. The treatment method for phantom pain and the treatment principles for complex regional pain syndrome, which involves unexplained excessive pain signals, share similarities with acupuncture. Regarding the reason for placing needles at the symmetrical points of the pain area, acupuncturists explain that it is based on the principle of balancing yin and yang energies. This is because the Huangdi Neijing, the textbook of acupuncture and the Bible of Eastern medicine, teaches treatment methods based on the yin-yang and five elements theory. However, recently, acupuncture methods have been developed for various treatment purposes, such as skin care, wound healing, depression treatment, and smoking cessation, that involve placing needles around the wound area instead of the traditional approach of placing needles at symmetrical points for pain relief. It may be difficult to explain this solely based on the yin-yang and five elements theory. However, the logic of spearing acupuncture can explain its principles. The principle of spearing acupuncture is as follows. Nerve cells detect puncture wounds below the symmetrical epidermis, and when a wound occurs, nerve tissue simultaneously transmits healing signals in addition to pain signals for wound protection. As a result, various hormones and immune bodies such as white blood cells, T cells, B cells, and NK cells gather at the signal site, promoting healing. Unlike traditional acupuncture, spearing acupuncture primarily uses fine needles made of a special steel material, causing minimal puncture wounds. However, nerve cells still perceive the situation as a threat, as if a foreign object has penetrated the body. As a result, many antibodies quickly gather in the affected area, leading to wound healing and hormone-induced effects. The use of electricity and fire in acupuncture is also a method to enhance these effects and stimulation. This acupuncture technique has become possible in modern times due to the use of specialized materials like special steel, as opposed to the stone-ground needles used in the past. While ancient acupuncture primarily focused on improving nerve system and relieving pain, today's acupuncture has evolved to consider not only pain but also immune and hormonal responses, being used for both wound treatment and cosmetic purposes. Along with the development of acupuncture, new techniques continue to emerge. For thousands of years, acupuncture has been shrouded in mystery. As I studied acupuncture, I struggled to understand the metaphysical and complex principles of acupuncture techniques and realized that there are numerous methods practiced both domestically and abroad. Like an old tree on one root but with various branches, acupuncture techniques differ according to their lineage, with acupuncture points that do not always match one another, yet each is recognized for its efficacy. Thus, I became particularly interested in this aspect of acupuncture. One of the secrets of the human body revealed by modern medicine is that fingerprints, irises, blood vessels, and lymphatic structures are unique for each person. Considering these differences in individual body shapes, I began to question the feasibility of locating precise acupuncture points and decided to revisit the origin of acupuncture methods. My method of time travel was to delve into the Huangdi Neijing, the earliest record of acupuncture. Initially, my limited academic background made it difficult to navigate the conversations between the emperor and the Taoist sage. However, I noticed that the old Chinese idioms in the text were used to convey events from the past in a condensed manner. Recognizing this, I employed a vague approach to search for solutions within the idioms and phrases related to acupuncture. During this process, I became particularly drawn to the term nerve stimulation. The term is composed of the characters for spirit, pathway, pierce, and spear. Translating directly means to pierce with a spear. Although this expression seems appropriate for life-threatening situations, we often use it to describe mild shocks. I became curious about the background of this usage. As I explored the connection between the expression, spirit pathway, and piercing with a spear rather than a needle, I discovered that ancient acupuncture texts mentioned the use of a spear as a tool for acupuncture. This led me to the spearing acupuncture method. Of course, attempting to interpret the entirety of acupuncture based on a single word could be risky. However, it is clear that a word that has survived and maintained vitality over time holds inherent meaning and value. I believe that the term nerve stimulation, which we have been using for so long, was created by people who practiced ancient acupuncture and has continued to be passed down with the dissemination of acupuncture. While I am not a practitioner of traditional Chinese medicine and have studied acupuncture as a personal interest, I am aware that it is important not to make rash judgments about the principles of acupuncture. Even today, the principles and origins of acupuncture have not been scientifically explained, leading it to be regarded as a mysterious medical art. Consequently, some acupuncture practitioners exploit this aspect, training students without incorporating modern scientific and biological knowledge, resulting in an overabundance of certifications and encouraging unqualified practices, which is a very concerning situation. I hope that acupuncture becomes more scientific and advances through active research activities. It is my personal desire for my research to serve as a small stimulus. Thus, I have introduced the term and rationale of spearing acupuncture to the world.